A prosthodontist is a dentist who's had 5 years education and then has specialized in restorative and reconstructive dentistry. So that takes approximately 3 years. It's a peer-reviewed situation, so that means that we're constantly being examined and challenged by the best of the best in our specialty and also in other specialties. And at the end of 3 years, you have to pass a set of exams and, in fact, publish a paper. After graduating, we all continue to do lots of ongoing education, and that's over a broad number of topics, not just prosthodontics, because it's really important to know what's out in the market and to be current with the latest techniques and materials, and also to be current with who can provide those services when they're appropriate for our patients. So, for example, last year I spent about 200 hours in continuing education, and the legal requirement is to have 50 hours in 3 years. So there's a lot of investment in staying current and knowing what can be done. A prosthodontist is, I think, two things. They're a strategic planner and they're a risk assessment specialist. So it means with those two skills, we can have a much better overview of what's going on in a patient's mouth and with their teeth. And it means that we're always considering what could go wrong, how we could avoid those risks, and how we could make the situation last longer, look better, and feel more comfortable. So that means we need to work with a high standard of precision. We use excellent supporting team members, the ceramists and the technicians that provide the work. And I think as a consequence, we have higher quality product. It fits better, it lasts longer, and we have less complications. So the benefit of this sort of an education is that the treatment we can provide means less unnecessary treatment done efficiently. Treatment with a prosthodontist therefore means that you're going to have a more controlled situation, problems have been anticipated in advance, and you should have more confidence that your teeth will look better, will look very natural, will be very comfortable and work well for a long period of time. So basically that you get value for your investment and that you get what you want, that you're not disappointed with the outcome. So the treatment is appropriate and it's of a higher standard than you would normally get at your general dentist. A general dentist is excellent for the basics. They have a very general education. It focuses in the 5 years that they go to university on how to basic biology and how to do things. So how to extract a tooth, how to clean teeth, how to fix a broken denture. They do these things on a daily basis. So they're cleaning your teeth, fixing your fillings, maybe extracting some teeth. And often the work that they're doing is fairly straightforward and often not exposed to complicated situations, or if they are exposed to them, they might not even recognize it as something that's going to be more difficult than just the regular sort of work that they do. So their expertise really depends on their own motivation. You know, they often focus on just a small area of dentistry in terms of continuing education, and there's no obligation for them to do anything but the basics. So what that means to the patient is that quite often a situation is underdiagnosed or frankly misdiagnosed, and that means that inappropriate treatment happens. You might have a tooth extracted that didn't need to be extracted, or you might have a denture design that is ugly or inappropriate when something simpler and more effective could have been offered. So that has a flow-on effect. It means that your confidence is affected. You might not be able to eat comfortably. You might not be able to go out with your friends. You know, functionally, you might just not be able to chew as well as you'd like to, or to chew and eat all the foods that you'd like to. So you might find it incredibly difficult. I had a patient recently who just said that the nightmare of her life is mealtime because she just cannot eat with her dentures. So it's affected her relationships with her family. You know, her family are constantly nagging her. She won't go out with her friends. She won't eat certain foods. She's living in a small room because she doesn't want to interact anymore. So just giving her something that can work well will really change her life. So the other issue, I think, at a general dental level is that quite often the quality of the work is not as good as it could be. Not because the dentist isn't trying hard, but because they've never been placed in that zone of rigorous scrutiny that a prosthodontist has. They've never had to be challenged on their work. No one reviews them. They go to work and just do what they do every day without any feedback. Whereas we've had to accept those challenges every day by people who are incredibly talented, our teachers. So at the end of the day, if you don't like the way your smile looks or the way your teeth look, then you're just not happy. You don't interact with your friends, you guard your smile, you can't socialize in a natural, uninhibited way. And if you compound that by finding that it's difficult to eat or painful to eat, or that you're worried that teeth are going to drop out or fall out or move, then it really impacts on you emotionally as well as physically. And of course, if these problems are ongoing and you have to continually see someone to try and resolve them, then it has a financial implication as well. So a prosthodontist really works hard to avoid these issues, and that's where we spend a lot of time in the pre-planning, in the risk assessment, in the diagnosis, and in the strategic planning. So before treatment starts, we discuss what can and can't be done, and your life changes with just good dentistry. When you come to see us, we do an initial consultation. It's 90 minutes. It's incredibly comprehensive. We're going to look at not just your teeth, but we're going to look at how attractive or unattractive your smile is, identify the problem areas, whether it's the gums, the teeth, and just look at every aspect of your smile and mouth. Our normal consultation process involves 3 appointments. The first appointment is to obtain all the information we need. What's happened to you in the past, what treatment has been provided, has it worked, what were your issues with it, where do you feel things went wrong, and what you'd like to achieve. We look very comprehensively at your teeth, your gums, your smile, and at your dentures and any artificial teeth that you might have. And then at the end of that appointment, we'll have a general discussion on what we think might be available to offer to you. Some people then need to go on and have additional information such as x-rays, CT scans. We often need photographs just to have a look and really assess these issues more closely. And the final point of your consultation process is an appointment where we sit down and discuss what can be done in your situation. So for a limited time only, we're offering the consultation for free. It's excellent value, and it may make a huge quality of life difference as well as a big saving to you in the long term. We'd encourage you to contact our rooms and take up this offer for the limited time that it's available.